a lot of people are obviously trying to get PMF to obviously help their sleep or help them fall asleep. But a lot of people seem to be confused on how they can apply these PMFs for that. So how would you maybe suggest people do that? Because a lot of people seem to jump straight to I'll lay on a full body mat in bed. Is that what you would do as well? Or would you maybe go for a different approach?
Yeah, so it's very confusing when you talk to people about a full body mattress because the word mattress, the word mat, we associate with sleep. And actually there are two different ways to apply PMFs when we're sleeping. If we are just looking at sleep and we are just thinking about applying PMFs to get us to sleep and maybe throughout the night keep us in a low frequency so that we're in like deep sleep rather than REM sleep, then you only need to apply the PMFs close to the head. So you're trying to change the brain frequencies into the delta frequencies. And, all you need to do is put a PMF device under the one side of the pillow or maybe on the bedside table. And that's how we're applying PMFs. When it comes to laying on a full body mattress, this is more for people that don't have time in the day to apply PMFs. This was one of my favorite ways to apply PMFs initially. And then I found different benefits and different ways of integrating PMF into my life to be able to get the PMF throughout the day and then actually just apply a device under my pillow for sleep. So if we've got a person who is trying to treat a chronic condition, yet they're a very, very busy person, they've got a long commute to work, they're in the office most of the day and they haven't got a device that they're using, within the office or within the time of the day, then they can use these sessions in the night and they can lay on a full body mat. But ideally, when we're talking about sleep and PMFs, we just want to be changing the brain frequencies and therefore using a device close to the head.
Okay, great. So now people have found out how it can help their sleep, found out how they can apply it. Now, normally the next question is, what frequencies and intensities do you use? We'll start off with frequencies. So what frequencies do you use for sleep or are ideal for sleep?
So as I mentioned before with PMFs, frequencies, when we're trying to heal things, when we're trying to create an environment in the body to heal, we want to use a range of different frequencies and we want to apply different frequencies to the body throughout the day. With sleep, it is important. It's all about using a low frequency. So if you're applying a device that is 30 hertz, 40 hertz, 50 hertz throughout the night, you're actually going to have the opposite effect of a sleep device. So you're actually going to try and get the brain into an alert state, which obviously is not what you want to be doing when trying to sleep. So it's very important that you're using a PMF device on the sleep frequencies, which are ideally anything from 1 to 4 hertz. And that is our deep sleep as well. So that's not just within, falling asleep and REM sleep. The way I apply PMFs for sleep is initially getting me to sleep. So it's the problem I have is switching off in the evening. I'll get into bed and I'm thinking about the next day. I'm thinking about a million things going on. And the process of me getting to sleep is the issue. And I think that's a problem for a lot of people when you get insomniacs and people with sleep disorders. The process of actually getting to sleep is mainly the problem. So finding a device that has the range of frequencies in a sleep mode from 1 to 4. And if you can find a device that you can change the time is also quite important, because rather than just doing a 20-minute session, you want to do like an hour, 2 hours, Some people even want to run them throughout the whole night. Not something I would recommend, only because you're kind of keeping your brain in that 1 to 4 hertz throughout the entire night. You might wake up quite snoozy, a little bit tired and a bit sluggish if you're doing it that way. So the key ingredient for me is 1 hour to 2 hours between 1 to 4 hertz.
So now we found our time and we found our frequencies. What intensities should people be using for sleep?
So intensities, again, is quite an important subject when we're talking about sleep. And we actually want to apply a low intensity, especially if we're treating right by the head. What we found in the past is that people that apply quite high intensity devices for sleep, again, it kind of has the opposite effect. So, at NewMed, we sell a device called the Hugo Intense or Hugo Pro. And actually, that's such a high intensity device that we recommend people even use it earlier parts of the day. Because if you're using it quite late in the evening, again, it doesn't have a great effect on sleep. So when I'm talking about intensities, I'm talking about anything lower than 20 Gauss. So again, if you've got a device that offers you higher frequencies to 20 Gauss, just make sure you've got the ability to lower those intensities down. A lot of the devices on the market are about 1 Gauss in this kind of sleep range, and that's absolutely fine when we're looking at just using a device for sleep. But then them devices are a little bit more limited in the kind of chronic conditions and healing side of things.